Hi there, my name is Andrew Vandenberg. I'm currently a second year physical therapy student at Campbell University, as well as a licensed athletic trainer. Welcome to my 5-part video series on how to perform VOMS testing and how to prescribe exercises for return to sport afterwards. I hope you enjoy. All right. The next portion of VOMS testing that we're doing is the Near Point Convergence test, or the NPC test. So for that, you'll need one ruler and then one object that the athlete can bring towards their face, with an X or any sort of letter on it that's about 14-point font. And so a lot of people use popsicle sticks and fill up most of the top of the popsicle stick. I found a ruler today and just used a dry erase marker to write on the ruler here. So I'm going to give the athlete, we're going to turn to the side here so you guys can see better. I'm going to give the athlete that ruler with the X on it, instruct them to hold it so that way it's facing towards them. Go ahead, extend your arm all the way. And I want to make sure that it's about eye level for the athlete. You don't want it too high or too low here. You want it right at the bridge of their nose. And all I'm going to instruct the athlete to do here is slowly bring the X in towards your face. Okay. I want you to stop when you see 2 of the X's or when I tell you to stop. Okay. So essentially when she sees double X, she can stop, or what I'm going to be looking for as the clinician is I'm going to be looking at her eyes, and if either of her eyes flare out at any point or anything like that and lose focus of the target, I'm going to stop her and measure that distance away from the bridge of her nose to our object here. So go ahead, Anna. She's doing a great job. You want them to go very slowly. You don't want them to go much faster than this because they may miss it here because you want to be really exact and precise with your timing.
Okay.
Nice. And so then you would take that distance from the tip of her nose to the ruler and measure it. You can relax here. Okay. I often tell them they can relax once they get it to the spot and blink a couple times, and they can blink during the test. But again, I'm standing here as the clinician trying to see if her eyes are moving off the target at all, or if one eye is straying versus another here. A positive test for this would be is you're going to do this 3 times, and then you take the average distance from all 3 times. If the distance of their averages is greater than 5 centimeters, that's a result of that's indicative of some vestibular dysfunction there. So that would be a positive result for this test there. Anything else would be negative. And so again, the 2 criteria are either if the athlete sees double vision, that's when they stop moving the ruler towards their face, or if the clinician sees the eyes move in an erratic manner, and that's also where they stop, and then you take the measurement from there. And then again, just like with any VOMS test, I'm going to ask Anna, did you have any headaches?
No.
Dizziness?
No.
Nausea?
No.
Fogginess?
No.
Cool. Alrighty, so as we look here at Anna's near point convergence, what we want to see is the ruler moving at a very slow pace towards her nose at about her eye level. You'll see here Anna's eyes start to cross a little bit, which is totally normal. What an abnormal would look like, and what we would see, is that as that ruler approaches her nose, you would see one or both her eyes kind of kick out and look back normal as if she was looking past the ruler. So that's when you would stop that test at that point and measure to the tip of her nose that distance that happens at. But Anna does a really good job here, staying focused and letting her eyes continue to follow the target in towards her nose. Now we see Anna is using a unique piece of equipment here. This is actually called a Brock string for those of you who are unfamiliar with it. Now this string was developed and designed for people that have any sort of convergence insufficiencies. And so this is a great example of a time that we can use it in rehab. Now, I can get into all the intricacies of what all the different patterns and ways that you can use the Brock string, but I will link a step-by-step guide in the comments section of this video or in the description of this video, because it is far too complicated for me to talk about here. But essentially, you take turns focusing on one of the beads along the string, and the string should make different patterns depending on how well you are focusing on that bead. It's a little hard to explain here, but again, I will link it, and the guide that I found has lots of pictures and descriptions, and I am very much a visual learner, so that was very helpful to me, and I hope it's helpful to you too. And I hope you guys can utilize the Brock string to help improve your patient's near point convergence insufficiencies.